Welcome to Pajon Imaging Series. In today's Radiographers and Health Professionals series, we look at pulmonary edema, how to make the diagnosis in chest X-ray. Please like, share, and subscribe to this channel so that you will be notified when new video is released. Welcome back. What is pulmonary edema? This is the accumulation of fluid in the lung caused by the extravascular movement of fluid into the pulmonary interstitium and alveoli. This leads to impaired gas exchange and possibly respiratory failure. The definition is simple. When fluid in the blood leaves the pulmonary blood vessels and enter into the lung spaces. That's all. Now pulmonary edema could be cardiogenic or non-cardiogenic in origin. Pulmonary edema is determined by the relative balance of the hydrostatic pressure, oncotic pressure, membrane permeability, and normal functioning of the lymphatic channels. So what are these pressures? Hydrostatic pressure is the pressure within the capillaries which drive fluid out of the vessel. Then oncotic pressure is the pressure related to the macromolecules in the blood which help to retain fluid in the vessel. Now, membrane permeability is defined as the ease with which fluid passes through the capillary or alveolar walls. Now, the lymphatic channels are used to remove fluid in the intercellular spaces, thereby allowing for return of the extravascular fluid back into the central vasculature. So you can see if hydrostatic pressure increases and oncotic pressure decreases, membrane pressure increases, and pulmonary lymphatic channel becomes defective. There could be obviously be increase and retention of fluid in the lung space. That is pulmonary edema. So you can see how this determinant can play and cause pulmonary edema to occur by defection in one or two, all of them. Pulmonary edema has stages. There are three main stages of pulmonary edema. We have the redistribution of blood, we have the interstitial edema, and it can now progress to alveolar edema. And there are radiographic signs or features we see, which is the main aim of this lecture. The signs, the features, the radiographic features of pulmonary edema are cephalization of pulmonary vessels, thickening of the interlobular fissures, peribronchovascular coughing, blurring of the cardiac and pulmonary vessel walls, Kelly lines, hilar enlargement, pleural effusion, air bronchograms, and confluent opacities. These are radiographic features of pulmonary edema. So let's look at how to identify these features in the radiograph. Let's pick the first one, cephalization of the pulmonary vessel. When there is much blood in the pulmonary vessel, that is pulmonary congestion, blood pressure will increase and this will cause some of the fluid to flow out of the blood vessel to the space inside the lung. And this fluid will tend to occupy the lung bases, these bases. This fluid will cause resistance to free flow of blood in the vessels in this region. That will cause redistribution of blood to the upper parts of the lungs. So the vessels in the upper part will become larger in size compared to the vessel in the lower part. So if you see the upper part vessels, you see the vessels there, they become thicker than the vessels in the lower parts. They become bigger in size. That is a redistribution of blood to the upper parts. We'll look at the second radiographic feature. That is the thickening of the interlobular fissure. Yeah, you see this X-ray, the horizontal fissure is thickening. You see this fissure here is thickening. And if you're in lateral chest X-ray, you'll be able to appreciate the oblique fissure. You'll be surprised it may also be thickening. Then we'll look at the third one, which is peribronchovascular coughing. the vessels will appear as if it has hair around it. It will become indistinct. You see some it appear blurred. Then look at the other side. Look the blurring of the cardiac and pulmonary vessels. Of course, you see the cardiac borders will be blurred. You see it will not be distinct. The borders here are blurred. It's not that clear. So you see these opacities everywhere. Then we'll look at the next one, which is a Kelly line. Now, Kelly line is a manifestation of fluid expanding the interlobular septal interstitium. It will have Kelly B line. It's found at the periphery of the lungs. It's about 2 mm or less than that. So you see this tiny line projected out, yeah, of the lung periphery. That is the Kelly B line. So it's a sign of pulmonary edema. Then the next one is hilar enlargement. Now the lung parenchyma grew out from the hilar. The pulmonary septa therefore radiates away from the hilum and are closest together at the hilar and furthest apart at the pleural surface. So accumulation of septal edema therefore is most apparent at the hilar, where the septa converges. You see this, there is a hilar enlargement here. And it resembles a bat wing. So that is that concept of bat wing sign. You see this other one too. See the hilar enlargement. And these other images too. You see the highlight alignment. This is a bat wing sign. Then we'll look at the next one, which is pleural effusion. We saw an image with pleural effusion before. Yeah, see this image down here. You see this accumulation here is pleural effusion. The last one is air bronchogram and the confluent opacities, which is a sign of interstitial edema and alveolar edema respectively. If you look closely, you see there are small round opacities. You see small round opacities. Then you see there is a linear structures, very tiny linear structures. You see that is the round opacities. That is a sign of alveolar edema. Yes, here is better seen than the other one. You see this round opacities. Then you see this linear structure. This is too big. But then you look close, you see very tiny linear structures that is black, showing the presence of air. That is air bronchogram. See, it's there, but this my marker is too big. So these are the signs we see in chest X-ray to make a diagnosis of pulmonary edema. So thank you. Like, share and subscribe to this channel so that you can be notified when new video is released. Thank you. Bye for now.